Hip flexor tightness? Do you feel like your hip issues are causing low back pain? This video will teach you how to address your hip flexors today. Welcome back, guys. This is Dr. Arash Maksudi.
Patient Dr. Michael Lau.
And today we're going to be talking about the hip flexors. Are the hip flexors tight? Do you need to stretch it more? How to assess it? How to reassess it? And if you guys have been enjoying this content, make sure to hit the like button below and let us know if there's anything else that you guys want us to cover. So let's start off with assessing the hip flexors. What we're gonna do is have Mike sit on the edge of the table here, rock back, bring one knee all the way in towards his chest. What that's gonna do is make sure that the low back and pelvis stays locked out so he can't compensate. Now, with the opposite leg, he's gonna slowly lower to where he feels like that's his end. And it seems like that's about all you got. Is that right, Mike?
Yeah.
Okay, so now if he let go of this or let this a little bit loose, you're gonna see this rocks down. That's not the right way of assessing this. You wanna make sure this stays locked out, and that way you can make sure you get an accurate reading of how much hip flexor flexibility Mike has. Now, if you look at Mike's leg, you can see that his thigh is actually not bad. It's parallel to the floor. However, if you look at his shin right here, you'll see that this angle is pretty large. Ideally, you want this a little bit closer like this. And it's not necessarily a bad thing. All that's letting us know is that his rectus femoris, or his two joint hip flexor muscles, are a little bit more stiff on this side. And we'll assess towards the other side in just a second here. But if I pull this leg down, I can assume that Mike will feel a stretch. Is that correct, Mike?
Yep.
Right on the front of the left thigh?
On the thigh.
Right. And then if I let go, that's where he likes to hang out. Now, if for some reason this was up like this, and this was all Mike had, now I would think that his one joint hip flexor muscles are stiff. This is the iliopsoas, versus this would be the rectus femoris. So it seems like it's more of Mike's rectus femoris here. Now you always want to assess to the opposite side. So let's have Mike lift his left knee in.
And this test is known for it's called a Thomas test. This is what the traditional name of this test would be called.
Yeah, so this is a Thomas test. Now we're assessing the right side. And if you don't have a massage table at home, don't worry. You can do this off the edge of a table, bed, whatever it is. And you can have someone take a picture of yourself and just measure your angles if you want to test and retest yourself. Now, same thing here. This side actually looks a little bit better compared to the left side, but you can still see that Mike's shin angle is a little bit more than what we want, which is towards the floor. Most people have a little bit of this elevated angle, but we can assume that Mike has a little bit more of a stiff rectus femoris. So Mike, you can come on up. So that is a way that you can assess your hip flexor flexibility. But now let's get into a couple of different ways that you can actually address this issue. All right, guys, so we're gonna start off with a static stretch of the hip flexors, and I'll let Mike take it from here.
So typically people are doing their static stretches like this. They're in a half kneeling position, and you see their entire trunk and body really translate over. And they look at the hip, I'm like, oh, I'm getting a pretty good hip flexor stretch. Really, we're not at all, because we have not locked that pelvis down before. So if you do want to statically stretch your hip flexors, typically in this point, our two joint hip flexors or rectus femoris, what we're gonna wanna do first, we're going to want to pretend we have a tail between us and tuck our tail between our legs. So with our pelvis, what we're doing is we are posteriorly pelvic tilting. We're tilting it back. You saw how tight I was on the table. The moment I do this, I already have a massive stretch throughout the front of my hip. I don't even need, that's about as far forward as I can go if I stabilize my pelvis. So again, these tests, it may look like we're getting a stretch or it may look like something short, but if we don't stabilize the pelvis, which is what Rash was saying, what we do with the knee, we can get a faulty reading. So again, tighten up the core, tuck the pelvis. I already have a stretch there. If you need to continue going forward, make sure you keep this nice and tight.
All right, guys, so Mike just showed you a static stretch, and if you guys want to do a two joint static stretch, you can also do this to get the rec fem a little bit more. However, these passive stretches only yield temporary results. How do we actually maintain those results? By loading the tissue. So we're gonna have Mike go through this exercise in that Thomas position where one of his knees is gonna be up in his chest. He's gonna bring the other leg down, and he's gonna put a kettlebell in the foot of the leg he's going to be working. Now, Mike is using a heavy kettlebell. Maybe don't even try this with weight at first, or use a very, very light weight. You can also use a resistance band anchored towards the floor. And what he's doing here is slowly lowering into hip extension. And then he can either use his muscles to pull back up or use his other leg to help him back up, whatever works best. But Mike is strong enough to lift this up. And towards the end here, he should feel a little pull, and then he's using those hip flexor muscles to pull back up. Oftentimes these muscles are stiff or limited in terms of flexibility because they don't have strength or stability. So we want to teach that area to have strength, therefore it doesn't have to end up stiffening up. So if Mike goes through a few reps of this, making sure he goes through that full range of motion, he should feel the front of his hip working with this exercise. Oh, yeah. And Mike, how you feeling?
Feeling good, and keeping the core nice and engaged too. You notice I'm letting it hang out for a couple seconds too, not passively. I'm actively letting it hang out, trying to get an end range stretch all while strengthening at the same time, trying to knock as many birds if you can with the same stone, same exercise.
This is strengthening to lengthen right here. And you can see at the bottom, Mike is much more perpendicular to the floor than he was when I initially tested him. So if I was to guess after this, if I tested him, he may improve in terms of that flexibility just from a loaded exercise. All right guys, so Mike just did that exercise on his left side. Mind you, he did not statically stretch on the left side, just that loaded exercise. And let's see how the length looks now. And if Mike drops, look at that shin angle. It's much closer to perpendicular as we mentioned in that last clip. So just that exercise helped improve flexibility, and we didn't even stretch in the traditional sense of stretching. So that's the idea of strengthen to lengthen. Now, another example that I like to do is just a static lunge, where what you're doing is you're getting into the split stance position here. You have one foot in front of the other. The further away your feet are, the more challenging it's going to be. But as Mike mentioned, you don't really need to go through so much hip extension and low back extension here if you focus on that posterior pelvic tilt first. Now, I got that posterior pelvic tilt, and I'm just going to lower, and I already feel a pull right here. I can hold that for a little bit. If I feel more comfortable, I'm breathing into it. As I breathe into it, I feel like I can go a little bit further, and then I push myself back up. And then I can just repeat this for a couple repetitions. Something
to note too, on Arash's split stance lunge right here, he has more weight on his back foot. So different than a normal lunge where we say cue forward, Arash is cueing himself in the middle, if not even more in the back. And that's really lining up everything on that right side. So again, he is actively working on his stability, working on everything while getting in that stretched end range position all at the same time.
Exactly. And I had a kettlebell here just in case I wanted to load it. You really don't need to load it that much. I mean, this is really pushing it, but the idea here is if you really want to put some extra load into that tissue, you keep your weight on that back leg, slowly lower. I feel a pull. I can hold there for a few seconds and then come back. I would definitely not recommend starting with this much weight. Start weight free. See how that feels. Make sure that you feel the pull when you're at the bottom position. You can hold, breathe into it. Let your body feel comfortable in that newly afforded range of motion that you've given yourself. All right, guys, hopefully you enjoyed this hip flexor episode. Hopefully you learned a little bit more about your hip flexors and that you don't only need to stretch your hip flexors. There's a lot of loaded exercises that you can do to actually help improve what you think of as your flexibility. And on that note, we actually do have a 6-week hip mobility prehab program. 8 weeks prehab program, even longer. 8 weeks prehab program that will teach you how to improve your hip mobility in all different ranges of motion.
And this hip mobility program, just like what we showed you today, works on both mobility of the hip, but then working on strengthening afterwards to really lock in those gains. Guys, we are here to help you. In addition to that hip mobility program, if you think your issue is just hip mobility, that's perfect for you. But we also have a hip prehab program. That is a fully conclusive hip prehab program for everything in and around the hip. That one is even longer. It is 14 weeks. You can find everything on our website or here by clicking in the box.
Yeah, we'll put those links down below. Let us know if there's any other topics that you want us to cover. And until next Tuesday, see you guys.